Hi, in this video we will talk about humerus of dog. Area of limb covered by this humerus is known as brachium. This humerus has two extremities, proximal extremity and distal extremity, and a body. This body is further divided into four surfaces. Humerus, on its proximal extremity, it has this head. This is head of humerus, which makes shoulder joint with the scapula. So this is the scapula, and you can notice that in the scapula, compared to the glenoid cavity, the surface area of this head of humerus is quite large. So this is quite bigger surface area. This is to allow the movement of this joint, which is kind of ball of socket joint, but the movements mainly are the extension and flexion in this area. On the lateral surface, on the lateral side of this proximal extremity, we have this greater tubercle. This is greater tubercle, and this is a large palpable structure on the lateral side, and it provides insertion to the supraspinatus and infraspinatus muscle. The infraspinatus muscle attaches or inserts to this smooth area on the lateral side. On the medial side is lesser tubercle. This is the lesser tubercle. In between the lesser tubercle and greater tubercle is this intratubercular groove, and tendon of bicep brachii, it passes through this intratubercular groove. Earlier it was also known as bicipital groove. Clinicians still use bicipital groove, whereas anatomists may use intertubercular grooves between two tubercles, greater tubercle and lesser tubercle. Regarding body of humerus, this is cranial surface of the body of humerus. This is the proximal extremity. This is the distal extremity. On the cranial surface of body of humerus, there is a rough area on the proximal side, and this area is for the attachment of brachiocephalic and part of pectoral muscles. This part is known as crest of greater tubercle. On the lateral side, we have this crest, and it ends as deltoid tuberosity. This is the deltoid tuberosity on the lateral side, and it gives attachment to the deltoideus muscles. This line is the tricipital line, and this tricipital line, it gives attachment to the lateral head of triceps, and also a part of teres major muscle. Lateral surface, this is the lateral surface of humerus, and this lateral surface is kind of spiraled. Here you can see it is spiraling around, and it looks like if someone has twisted this humerus. So this spiral, it was also known as musculospiral groove in earlier days, but now it is known as brachialis groove, and it has brachialis muscle in it. Along with the brachialis muscle, also it has radial nerve along with it. So any blunt trauma or any injury on the lateral side of humerus may lead to the radial nerve paralysis. This is caudal surface of the body of humerus, and it is usually smooth and round, and it ends in this olecranon fossa on the distal extremity. On the medial surface, this is the medial surface, and we have this crest of lesser tubercle. This is the lesser tubercle, and on this crest of lesser tubercle we have this teres major tuberosity. Teres major tuberosity, it gives attachment to teres major muscle and latissimus dorsi muscle, and also medial head of triceps and coracobrachialis muscle, they also attach in this part. On the distal extremity, we have these two condyles. Condyles are the knuckle shaped structures, and these are two condyles. In between these two condyles is a trochlea. This pulley-like structure is known as trochlea. On the lateral side of this trochlea, this part is known as capitulum, which articulates with the head of radius. On the sides of this distal extremity, we have these epicondyles. This one is the lateral epicondyle, and here in this view you can see this medial epicondyle is larger than the lateral epicondyle. Lateral epicondyle is much smaller, and it gives attachment to the extensors of carpus and extensors of digits. and also supinator muscle. Also the lateral collateral ligament for the elbow joint attaches here. This is the medial epicondyle, and this medial epicondyle is much larger, and this is also an important landmark on the radiographs. You can see on the radiographs this medial epicondyle is much larger. It gives attachment to the flexors of carpus joint and digital flexors, and also it gives attachment to the pronator muscle, medial collateral ligament for the elbow joint. On the caudal side of distal extremity, we have this depression which is olecranon fossa, and on the cranial side we have radial fossa. These two fossa, radial and olecranon, they communicate each other with this foramen. We call this foramen as supratrochlear foramen because it's above the trochlea. This is the trochlea, pulley-like structure, and no special structure passes through this supratrochlear foramen. That's all about the humerus.